Hey guys, I wanted to spend a few minutes talking to you about special medical conditions. I just wanted to share um, some experiences I had. I taught in the classroom with young children for about 13 years, and during that time, I had a lot of really great experiences with children with special medical conditions. So, for instance, I had a child who was 3 one time who was very, very allergic to several things, including peanuts and grass. His peanut allergy was so extensive that it was actually terminal, meaning if he was exposed to peanuts, he could possibly die. So we had to take extreme measures, for instance, making the whole child care center a peanut-free place. Children even had to wash their hands as soon as they got in because a lot of children would actually eat Chick-fil-A for breakfast on the way there, and if they had the peanut oil from the chicken nuggets, that could actually be touched on a doorknob by this child, and he could go into shock. He could possibly die. He could have a allergic reaction. So parents had to learn alternatives to peanut butter and so forth, like almond butter, sunflower butter, and Nutella, which actually kids like a lot. This child also carried an EpiPen with him. And so, well, we had it locked up, but we had to learn to give him his EpiPen to administer it if he had an allergic reaction, to where his fingers would swell, his tongue would swell, his body would break out. And so that's why it's really important when you're working with young children to take a first aid CPR course, so you learn things like how to administer an EpiPen. Another one that is commonly dealt with is asthma. I've had several children that had asthma, and so what that means, as you'll read, is it's very, very hard for them to breathe. Sometimes it happens when they've been running too much or outside. There's several factors you'll learn about, but in this case, you learn how to use an inhaler. They'll have inhaler medicine, which is prescribed. A very common one is albuterol. And so you have to learn how to help a child administer a inhaler. Another one that's not quite so common, but it's still out there, is diabetes. I had a child in my toddler class who was a diabetic, and what this means is her pancreas didn't work very well, and so she needed help to regulate the insulin to break down the blood. The sugar in the blood. And so every day at meals, she would come up to me to have her finger pricked to check her blood sugar level, and then I would give her an insulin shot, usually in her stomach or her leg or her arm. We change it up to regulate her insulin. So these are all things that you're not just reading about to have to read it. They're things that you will encounter working with young children. So it's really important to go through this chapter and keep these things in mind as you work with young children. So that's a little bit about my experience. Now dig into chapter 4.